What is a problem that I like to help people work through? I deal a lot with men who struggle with addiction, men who struggle with ultimately trying to medicate their pain away, but they don't often realize that that's what's happening. So, a lot of what I'm doing is trying to help men actually begin to be curious, to notice what's happening inside of them, and then recognizing that so often our addictive behaviors are actually attempts to take care of ourselves. I usually say that it's our attempt to solve a problem that's become a problem. And so now what we have to do is we have to focus on the problem of whatever that addictive behavior is, as well as really get to the roots of what is it that is so untenable, that's so uncomfortable, that's so difficult that I have to use this behavior or substance or whatever it is to try to escape. And so that's really the two part of helping them understand and recognize what that dynamic is. And then it's a process of trying to help them begin to work through. Most of our hurt begins in our childhood, it begins in our developmental years of trying to make sense of different experiences. And what happens is we start to develop some beliefs about ourselves that are negative, and then we spend the rest of our lives trying to control against those or medicating out of those. And so that's what I try to help, especially men, work through a lot, is recognizing the struggle, having self-compassion, learning to work through whatever those hurts are using EMDR or parts work or different things. And then also really encouraging them to recognize when they want to go to those behaviors and instead turn to themselves in a self-kind, self-compassionate way to try to be understanding and learn how to avoid actually going that, because that creates a whole shame cycle that really makes it a lot worse for a lot of people.